Don't think it's, oh, maybe it is. Hi, good morning. I'm Samantha Brandon Beverly. I am the Senior Account Manager for the City of Binghamton. I've worked with Tom for several years and Sandra as well for several years now. And I'm a financial planner by trade. It's how my career started. But I always like to, people often ask me, how did you end up in Medicare as a financial planner? And it becomes very simple. It's a family story. So I'll give me 30 seconds and I'll tell you. I always talk about the things that no one ever tells you when you're 18 years old, right? You do everything right. And I went to college and met a nice boy and got married and started a family. But I had a special needs child. And at 26 years old, we were thrown into a world that we knew nothing about at all. My son, shockingly, passed away when he was 10. And that was a few years ago. And we were left with $1 million in medical debt. So not only do you lose a child, but you're about to bankrupt your family, right? My husband and I, who's also in the business, we said we promised we were never going to let that happen again to another family. And what I found as a financial planner was as we were sitting in these meetings preparing people for retirement, everyone wants to talk about your 403B, 401ks, your investments, all of that. No one talks about the cost of your medical care in retirement, the cost of your prescription drugs, and how one diagnosis can completely derail your retirement. So we started a healthcare division within our financial planning firm. And then in the end, I ended up saying, we need to make this bigger. And it's an important conversation. And I met several people at Aetna who was working with retirees, doing the group benefits. And I said, I think I can make a difference. This is important and this is critical. So I jumped in. So here we are. So I'm going to take a look at this both from a financial planning perspective, as you know, with my advisor hat on, but also from a health perspective. I'm a bit of a dork. I went to Cornell. I was a statistics major, so I'm all about the numbers, and I've ripped this plan apart, upside down, in and out, because I feel very strongly, as Tom will tell you, that we keep the benefits where they are. And if we do any change, it better be for the better and not being, as Tom said, reducing benefits as costs go up, right? That is the worst thing we could do. So the one thing I do want to start out by saying is this plan that you have really phenomenal. And I truly mean that. And I'm going to explain several reasons why. You have, as you know, friends and family who might have had to buy plans on the open market. They might have plans that are $0 a month. They're out there, right? We know that there are additional benefits that they may get, but they don't have nearly the protections that were built into this plan. And the other thing I would like to say is that everyone that we worked with during this renewal process this year, not one person from the city of Binghamton even suggested removing a benefit. And that says a lot in this day and age, right? Where everything, inflation is high, prescription drugs are high, medical is high. And to have, your leaders continue to say, we made a promise and we're keeping it, that says a lot because that isn't happening all across the country. So I wanted you guys to know that, that you really do have people in your corner fighting for this plan and for your retirement and protecting it. So that's incredibly important because again, not everyone has a team behind them, right? It's all about the money, and yours was about the promise. And I love that. Again, it was a story to be told. So the first thing I want to talk about, the number one protection on your plan, okay, is what's called the maximum out of pocket, okay? That number is what you can be legally held responsible for in any calendar year. This is going to be the critical difference between any plan your friends have and the plan you have. The most your household could be financially responsible for is $750 for you and then your spouse. Total household exposure. is $1,500 for you and your spouse. You're not going to bankrupt your family on this plan. They made sure of that. And I'm going to tell you some of the few ways you could get to that $750. But after you reach the $750, everything goes to zero for you. No more hospital stays, no more co-pays, nothing. You also have no deductible on this plan. And what that means is from day one, $1, the insurance company is helping to pick up the tab. And that's amazing because a lot of people will have to pay the Part B deductible, or they have to pay the Part A deductible, or they may have, if you have friends that are on commercial plans, with their employers now, they may have a $5,000 deductible. So it's like having no insurance unless something really happens to you. In your case, from day one, the insurance company is paying for your care. And again, I think that's critically important. So let's talk about some more specifics. So the biggest risk that I see, again, as a financial planner is people often say to me, if the worst case scenario happens, what's that going to cost me? So I always use the example of what happened to my mom during COVID. My mom is the CEO of a company. She was a runner, never on any meds. Last time I was in the hospital, she was in childbirth. That was it. So 40 something years ago. Drops down with a heart attack, just out of the blue. Had to be airlifted. 4 open heart surgeries later, 62 days in the cardiac ICU at Mount Sinai. If she was on this plan, do you know what that would have cost her? $250. That is the cost of an inpatient hospital stay on this plan. And that's per stay. And what that means is you could have 3 different stays through the course of the year. And I'll explain how that breaks up because it can't happen one right after another for the same cause. But 3 different incidents and you are done for the year. But $250. Do you know what her bill was from Mount Sinai? $2 million. $2 million. If she was on original Medicare, the way the plan is originally designed, that's an 80-20 plan. They pay 80% and you pay 20% of an endless number. There is no maximum out of pocket with original Medicare. I don't know if anyone knows that, but you are protected by that $750. So if my mother was just on original Medicare, woke up from anesthesia, she would have known she'd have to pay 20% of $2 million, $400,000, right? That will bankrupt the family. There you go. That's why we want those maximum out of pockets. In the open market, if you were to go to Medicare.gov, type in your zip code and see all the plans that come up in your zip code, take a look at those maximum out of pockets. They're usually 9,000, some are 6,000, but out of network could be 13,000. It could be crazy. And again, if you're doing it times 2, that's tremendous. That could be your entire pension, right? For an entire year is just being based on those numbers. So anyway, you're protected. $750 per person per year. And that's medical only. We're going to talk about the drug side in a few minutes, okay? Yeah.
Many of these plans had limited network. You had to come back home to see Excel or go to a specific carrier provider. Those have changed now so that all you have to do is make sure they accept Medicare.
Yeah, so you have what's called a, yeah, and it is a big deal.
Very good. Any national. Maybe a few specialists that can take Medicare, but this is a big deal. You can go anywhere you want, anywhere in the country where Medicare is accepted.
Yeah. So can't hear me or Tom? Okay. You have what's called an ESA PPO. just, we love our acronyms in the insurance industry. That's an extended service area provider network, basically. So a PPO means you can go out of network and it's just a higher copay to do it. However, on this plan, you can go out of network and there is no additional cost at all. It's the same charge. So there are just two requirements of any provider. Number one, as Tom said, they have to participate in Medicare. So what that means is that they've actually signed a contract with Medicare and they've agreed to the rate structure. So that's really important because sometimes I hear from people, oh, my physical therapist said they only get reimbursed X, Y, and Z, and so they want to charge more. But they negotiated those rates with Medicare themselves. That's a contract they signed. So don't ever feel guilty about that. No one's forcing anyone to sign anything, right? However, the second requirement outside of them having to participate in Medicare is that they have to agree to send the bill to Aetna. And there's a reason for that, which is we don't want you standing there in a moment of crisis getting held hostage by someone saying, well, pay $10,000 up front to see, Mr. Cardiologist here, and then you submit for reimbursement. That's not how we want this plan to work. We want them to send it to us. Let us work with the billing department. I don't want you on the phone all day long, going from person to person and trying to figure out what you owe. So if anyone hands you a bill and they're insistent and you've just had it and you're like, whatever, I get that. So if that happens, number one, you want to make sure the bill you are being handed and asked to pay for only contains their Medicare reimbursable rate. They're not going to hand you a bill for $10,000 and say that's what you owe, right? You want the rate that they negotiated and signed with Medicare. No one at the front desk is going to be able to do that, right? They're going to have to hand it to a billing department. So make sure, what I don't want, again, let's say you're getting cancer treatment and someone at the front desk who doesn't know, all the ins and outs of billing and they don't know anything about Medicare says, oh, you have to pay the bill up front and then get reimbursed by your insurance department. You would say, A, no, I don't. And B, I want the Medicare approved rate. And then you say, well, the one thing to know is you always have to add the line, this is my retiree plan through the county, the city, okay? You want them to know it's not the typical plan that someone could get on the open market. Because a lot of times someone answering the phones at an office may just immediately say, we don't take that plan. We don't take Aetna. We don't take United Healthcare. We don't take Fidelis. They just immediately spout that off. You don't fall into those categories because you have this ESA PPO. So it's a very, very different plan and one that has just been customized for Binghamton. So we want to make sure, again, that you're getting the care you need, that no one is asking for you to pay anything up front. Let it go through the insurance company first. It can take months for a provider and an insurance company to settle the bills back and forth, right? It's all about codes. And they keep you informed, right? You're going to get a notice from your doctor's office that you owe this balance and that balance. Wait for the explanation of benefits, the EOB, from the insurance company. Give it time to settle. So don't immediately, start calling everybody, the billing departments and all of that and sitting on hold forever and say, why am I getting this bill? They may not have gotten paid yet by the insurance company. It could take months for them to settle all that out. Don't worry. So it does get itself worked out. It could be coding, it could be timing, it could be anything, but you're going to be okay. So, please rest assured that that is very common, probably one of the most common questions I get. I just got billed for my annual physical and I thought that was included. They just haven't settled the billing yet. Okay, so don't worry. So that is number one. Number two, we're talking about your knee replacement, right? Do you know what an outpatient surgery would be on this plan? If you needed a knee replacement, shoulder surgery, anything like that, $50. right? My goodness, that's right. Yeah. So, oh, really?
So I just had a knee replacement 4 weeks ago. Take a guess. The surgeon's bill is about 45 grand. All the rest of the other stuff, you know the deal. How much is it? $50. That's not what I paid. I have a $5,000 deductible on my plan.
Yeah. So if you had a deductible, so in Tom's case, he'd have to pay that $5,000 first before the insurance company even exists in his world. You don't pay anything. You have no deductible, right? $50 for an outpatient surgery. Again, in looking at the ways of how healthcare can derail your retirement, we just covered the two biggest: outpatient surgeries and inpatient hospital stays. Those are the biggest. Has anyone have any questions so far? Yes, ma'am.
The issue is that if we don't use the microphone, the video can.
I wanted to ask, in your experience, if you've paid a bill in full because you felt threatened,
Mhm.
have you ever heard of them reimbursing you after the insurance settles?
Yes.
They will.
There's a big however with that. So again, the bill you were likely threatened over, right? Which again is not, unfortunately, not uncommon, right? Providers want their money. Likely you paid the full amount and not the Medicare reimbursable rate. So when you do end up submitting the bill, and if that happened to you and you submitted the bill to Aetna, you would get reimbursed. However, you're only going to get reimbursed for the Medicare approved rate. So if you paid $250, but they had negotiated it down with Medicare to $50, you're out $200. And now you have to either fight with the provider to give you your $200 back. Good luck with that, right? Or you're going to be angry, right? And rightfully so, because it's shocking. So that's what I see as the biggest disconnect is people don't know to ask for the bill that has the Medicare reimbursable rate. You're just being handed the full, the full kahuna, right? You don't want that. That is a danger financially. But number two, if you are, for instance, going through treatment, have an expensive procedure, even if, let's say you do have that inpatient hospital stay, not everyone has the cash flow that person has. $250 could be a very big number in a household. So if that happens to you, you do not have to pay it all up front. Every hospital in this area has payment plans, every single one, and they have 0% in interest. So it's not like taking on a credit card payment or something like that. You can set up a payment plan with any hospital in this area and they will not charge you interest. You just pay a respectable amount, could be $20 a month, could be $10 a month, whatever you can afford, and it just keeps going until you've settled your bill. So please don't feel, again, the pressures that some families have felt that they have to put out that lump sum right away. You do have options, okay? So make sure you're speaking to them and ask them, do you have a payment plan? That's a big deal. So what I do see is, where do the copays start adding up, okay? It's when you're going through things like ongoing specialist visits, chemo, dialysis, ongoing physical therapy, right? On your plan, those are $15 for a specialist visit and $15 to see your primary care physician, okay? So if you're just one of those people who goes once or twice a year and it's no big deal, you're not going to feel the impact of that. However, if you're going to chemo every single day for the next several months, you're getting hit with 15, 15, 15, 15, 15. That adds up and adds up quick. That's another way that I see people start getting nervous, right? You get jumpy. Again, set up a payment plan with the facility. Do it. Take 2 years to pay it off. Take 5 years to pay it off. Get healthy, get better, take care of yourself. That bill's not going to go away, but it could take the impact off for you. Okay. Don't charge it on your credit card and not pay it, because that's where you're going to get hit with 25% interest, right? Don't do that. Set it up at 0% with your hospital. That's the best way to do it. Okay. Yeah. Financial planning 101. I'm the dork. Yeah. That's
But
what I keep thinking.
Samantha, still the end result is your annual maximum out of pocket with all those $15 charges. It's $750.
Yep. So again, that is your total financial exposure. So that includes surgeries, ambulances, anesthesia, all the chemo, all the surgeries, all the specialists, all the second opinions, all of it falls into that 750. That's amazing, right? So mathematically, it is kind of hard to get to 750, even with the $250 hospital stay. And I'll tell you why. So you end up in hospital visit number 1. That's $250. You get discharged, you go home. For the next 60 days, if you are readmitted for the same thing, there is no additional copay. Now, if you're going through, let's say you had, cancer surgery, okay, that was copay number 1, but then you go home, you fall and you break your hip. That's a different story, right? You're being admitted for a totally different reason. That would be number 2, okay? And then you would have still the 60 days of the cancer treatment, now 60 days of the hip, the hip surgery. Okay, now you could have your third instance if that were to happen. But again, if you're going through multiple, like my mom did, right? She had 5 surgeries, but it was all within 62 days. So she still only had that 1 copay. Okay, so again, if you're being readmitted for the same thing or having multiple surgeries, you're going to be protected there as well. So again, that $2 million bill, $750 at the most. In my mom's case, it would have been $250 because she only had 1 stay. All right. So some of the things that we think are critically important, there is a lot that original Medicare doesn't cover, right? Did you know they don't cover annual physicals? That you get 1 welcome to Medicare physical when you turn 65 or just join a plan. Then it's gone forever. All you can get is what's called a wellness visit. Do you know what the definition of a wellness visit is? You're going to laugh. Okay, your clothes have to stay on. They cannot touch you. They cannot do any testing. There is no EKG. There is no blood work. They can't test your hearing. They can't do any of it. It is a conversation with the doctor. That's it. That's all they can do. What is the point of that, right? No one knows. No one knows. So on this plan, we added an actual legitimate annual physical for every member. Go get it done. Absolutely get it done. However, what I do say to people on this plan is because your primary care physician and your specialist visits are the same copay, $15 each, right? If your primary care physician isn't a specialist, doesn't have a specialty, and you need to see a specialist, let's just say you're being followed by cardio, right? Go see your cardiologist. That cardiologist can run most of the things that annual physical would cover. They could do the blood work. They're going to do your EKG. They could run a lot of that stuff. So again, in a way to reduce your copays, you can always be going to see the specialist related to your concerns and not have to worry about the exorbitant cost. So the $15 for specialists was the lowest one available in the Binghamton market. So again, if you're looking at friends and family plans, most of the specialist copays are anywhere from $40 to $60, could be even higher if they go out of network. For you guys, it's $15. So that, again, that's amazing, right? Another way to just protect you. So there are 72 different elements of preventative care that are included in this plan at $0. So all of your immunizations are covered. And now the shingle shot, right, which was never covered before by Medicare, that's now covered. So you can go, you get your flu shots. anything you want. So some little tricks that I have learned. If you decide to get your immunizations from a doctor or specialist, they can technically charge you for that visit, right? Because you're seeing them. That's why you do see a lot of people go and get it done at the pharmacy, because there won't be a copay to do that. So again, you can do that. But, and again, as a way just to kind of keep your costs down, you can do that.
Samantha, if I can add something,
Of course,
have you had your shingle shot yet?
please do it.
I just had to do that. Remember, I have a deductible. That's
Yeah.
$390
Yep,
for me. For you,
0.
get it done. Have you had shingles? It's,
Ugh, it is brutal.
It is awful.
Yeah, it is awful. Definitely not something you want, and definitely easily, people still get it even if they've had the shingle shot. However, oh my goodness, let's reduce our risk if we can, right? Because that is painful and uncomfortable. And once it flares, that's it. You're in a world of hurt. So this would include cancer screenings, bone density tests, colonoscopies, mammograms, so many things. Like I said, 72 different items are all at 0. You don't need referrals for anything. So if you want to go see a specialist, go see a specialist. If you want a certain test done, go get it done. Again, you do not need any referrals on this plan at all. The emergency room and urgent care. This is awesome. Has anyone been to an urgent care facility near here? New York is like notorious for, we've just really jump-started the urgent care concept. So it's $65 if you go to an emergency room, right? And that's waived if you're admitted. So then again, you'd have that $250 copay. However, it's only $15 if you go to urgent care. So I always say you might want to consider that. Find the one that's closest to your house, because they can do stitches, they could do the shots, they can prescribe medications. There's so many things that they can do there. They have x-rays. So again, you can get a lot of your stuff done in a much smaller facility without having to wait hours on end in an emergency room where now you're exposed to all these other sick people. It's just something to consider for certain elements that you might be having done. So again, unless you've fallen and broken your hip or something like that, a lot of the reasons people go to the emergency room can actually be handled in an urgent care facility. So if you have the flu or think you have COVID, those types of things, go to urgent care. Absolutely. Number one, you're going to save yourself, a lot of money in copays, down from $65 down to $15. Number two, you're going to shorten your wait time significantly. And number three, you're not going to expose yourself to nearly the amount of people that you would in an open emergency room. Okay. All right. You have worldwide coverage on this plan, just so everyone knows. I get that question a lot. Original Medicare is a domestic program. I don't know if anyone knew that, but it's a domestic program. They do not cover you outside of the United States on Original Medicare. On this plan, you can have emergencies and urgent care, again, at the same identical copay that you have now abroad. So whether you're on a cruise, whether you're, I had a client fall down the steps in Rome and, ended up in traction for 6 weeks, all that stuff. It was, I know, right? People get hurt on vacation. It happens. So anyway, it would be your $65 copay or your $15 copay, depending on how, on how you utilize the service. However, I always warn people, do not give up travel insurance in lieu of having Medicare abroad, and there's reasons for that. So the client who fell down the stairs, well, yeah, your medical care is taken care of, but now you got to change your flights. Now you need hotel stays. You might need an Airbnb. You're traveling with someone and they need to change their flights. Now you got to extend the rental car. There's a million different scenarios of what would be covered under your travel insurance that isn't covered medically. Okay, so just be prepared for that. So I always say continue to get your travel insurance because it covers a lot that wouldn't be covered under your medical plan. That's really important to know. Again, all lab services are also zero. So any lab tests, like during your physical, if any of your specialists want to run lab work, that's all zero. So that's fabulous. Any diagnostic test, this is so cool. Again, cool, if you're going through medical stuff. But again, financial planning hat on. MRIs, CAT scans are crazy expensive. PET scans, right? Which is the full body cancer scans. $15 on your plan. I mean, how amazing is that? $15. So I'll tell you a quick story. One criticism that we often in the insurance world has to do with prior authorizations. So I thought we'd spend a minute talking about that. Prior authorizations are supposed to be, and I say supposed to be because it doesn't always work this way. It's supposed to be an electronic conversation between your provider and the insurance company. And it's supposed to be a check that you are getting the correct care. And it's not, what I often hear is, who's an insurance company to question my doctor? My doctor ordered X, Y, and Z. And there's a famous phrase in our business, it's called fraud, waste, and abuse, FWA. We now have to be tested on it every year. There's a shocking amount of that goes on in the insurance world. So, for instance, I had a special needs child, as I told you, was on Medicare, because if you're on disability for 2 years, then you roll on to Medicare. With no symptoms, no family history, nothing like that, the doctor ordered a PET scan, the full body cancer scan. It's $45,000. And it got flagged by the insurance company. And I said, again, I was 26 years old, said the same thing everyone else says to me now, which is, who are they to question what my doctor wants for my son? And they said, he has no symptoms. He has no family history. He's 8 years old. Why would he need a PET scan? And they were right. They were absolutely right. And that to me changed my view. It reframed how I now see it, because I was like, okay, yeah, okay, that makes sense. So all the doctor has to do is show it's medically necessary. That's it. It's not supposed to be drama of, oh my God, they're not going to approve my hip surgery or, my shoulder surgery. There are certain breakpoints. When something gets expensive, they're going to raise a flag and say, is this necessary? Does this patient really need brain surgery? Let's figure it out. Do they? That's important to know. And I'm kind of glad that that's there. However, it scares people because they mentally think a prior authorization means something's getting denied. That isn't at all the case. So the insurance company sends an alert to the doctor saying, show me this is medically necessary. The doctor just has to respond. And if the insurance saying, look, this is the test we ran, these are the results we got, this is why I want to do it, this is the path we're taking, and just show the steps of what they went through, and boom, you're done, right? And again, as long as it's a Medicare approved surgery. If it's experimental, no insurance company is going to cover it. So, it wouldn't matter what plan you were on. So anyway, that's a big deal because people get nervous when prior authorizations get flagged, because at Aetna, they will send you a letter saying, keeping you in the loop of what's happening. They'll say this service requires a prior authorization. When you get that letter in the mail, you don't have to do anything. It wasn't meant for you to take action. It was just an FYI that the insurance company's talking to your provider and they're waiting on a response. So the number one reason I see denials come across is because the providers haven't responded to the inquiry in the required amount of time that was set by Medicare. Medicare has incredibly strict rules regarding how quickly a provider has to respond to an insurance company. And again, that's for your protection. They don't want someone sitting on something for 60 days. If you're waiting on, a cancer treatment and, you're waiting on a prior authorization and the doctor just chooses not to respond because they're busy and understaffed, that's crazy, right? How scary is that? So if they don't respond in the required amount of time, boom, it gets denied. And that was intentional. Medicare wants you to be aware if you have a non-responsive provider. because that is not safe, right? That can be dangerous for a member. So have the conversation with the provider. That's when you do it, right? When a denial has come through. If the denial came through because they didn't respond or because they couldn't prove whatever they prescribed was medically necessary, there are several steps to take. So don't immediately think, oh my gosh, I hate everybody. I would say that. But separate from that, number one, a doctor and you can always ask for an appeal. If you appeal something that's been denied, it doesn't come back to the insurance company. So no deny, deny, deny. Remember that phrase from like the 80s and 90s? They've done away with that. It goes to a third-party medical team. They look at your doctor's records. They will look at everything and every response from the provider, from the insurance company. If you have an appeal, the insurance company isn't the one saying no again. It's not going to happen. It goes to a third party called Evercore. And they look at all the insurance companies and all the denials. It's kind of neat, right? And again, in our best interest as patients, that an insurance company can't just go in, deny, deny, deny anymore. Someone else is about to look at those notes and look at those records to make sure that that denial was correct. All right? Your doctor can also file for an exception to be made. So if for whatever reason your surgery or something was denied, they can ask that an exception be made, and they could say, hey, look, we tried X, Y, Z. We sent this person to 2 different hospitals, 3 different specialists, all these different medications. This is it. This is our last option. As long as they can show that, again, they have the ability to make the exception. And you can also file 3 appeals overall. If you disagree with appeal number 1, you can file it again, and you can file it again. So, again, there's a lot of protections in place to allow you to get the care that you need to stay healthy and to get better and to heal and to have the best providers on your team. So I love that. So we'll talk a little bit about some of the additional things that people often ask me. As you know, as I mentioned before, Medicare doesn't cover everything, right? They don't cover dental, they don't cover vision, they don't cover hearing aids. That's very emotional for people, right? Those are the things we know we're going to need going forward. There's a whole list, huge list of things Medicare doesn't cover. But in the lines of your books, you will see Medicare covered dental included. So I always feel like I have to explain what that means. So I'll give you the real life scenario. If you get into a car accident, break your jaw, and the teeth come out and need to be surgically replanted, that is something Medicare will cover. If you need a cleaning, a root canal, an extraction, a bridge, an implant, no. Okay, so your traditional dental care, that is not what Medicare covers, okay? But again, they will cover that medical crisis. But even for some people that are having teeth surgically removed, that may not be medically covered because, again, it has to be very strict. It has to be very, very specific, okay? So does anyone have any questions about that? Yes, sir.
Can dental services be added to this plan?
Can you say that again?
Can the dental services be added to this plan?
So we've discussed options regarding that. It doesn't look like that's going to happen at this point. However, it's on the table. We've talked about it. We've reviewed it. And not just with Aetna, but with the other companies. Again, we ran several. I'll tell you what a big issue is. A lot of it has to do with New York in general. We're the toughest insurance state in the country, right? New York's dental insurance is not good in general, no matter what plan we look at, we looked at Delta Dental and all of that, right? They don't cover an awful lot. And so the main questions I get aren't about cleanings and the x-rays, fluoride, and exams. It's about implants, right? Do you cover implants? Do you cover bridges? These things are thousands and thousands of dollars. And so we're talking about the people who say, I spent $25,000 last year in dental. What could have covered that? Nothing in New York is going to cover $25,000 of implants. We don't have it in New York. And we also have an increasing number of dentists who don't take any insurance at all, or they've created their own plan. And so you can only get the plan through them. It's become a very challenging environment for anyone. So when you look at the additional like separate Medicare plans that do include dental, you'll see it might include your cleanings and maybe $1,000 a year, $1,500, $2,000 at the most, those types of things. But again, if it's rarely those people who are looking for the 1,000, 2,000. They're looking for the 10,000, 20,000 number. And in New York, it doesn't exist.
Yeah, let me add a little to that.
Yeah,
Thank you,
please.
Samantha. What we find is this population group has much higher utilization than the active population. Most of active plans, when you're an employee, the average annual maximum benefit is somewhere in the neighborhood of $1,000 to $1,500 a year. And in most cases, when it comes to the major services like implants, dentures, bridge work, they typically will only pay 50% of the bill up to that $1,000 maximum per year. In addition, they might charge you much heavier in premium because of the use of this population than the active population. And I'll just give you an example. $1,000 plan for an active population might be in the neighborhood of $30 to $35, $40 a month. For a individual of 65 plus, that number might be $70 to $80 a month. In addition, these carriers don't want 5, 10, 15% of the population taking the benefit. They want 80% because they need to spread that out, that whatever they're collecting in premium from you covers the bills that you're pushing into the plan. Am I making sense? What happens is your utilization then dictates what the rate is going forward. So if $70 isn't enough to cover all the claims that you're using, guess what happens? The rates go up. So I wish I could give you a better answer, but I'm just giving you the straight answer on how these things work. Dental plans tend to be like a Christmas club. In other words, all you're really doing is paying for the utilization that you're going to be using on a monthly basis rather than all at once when you use the plan without it. Does that make sense? Just one more final point. The other problem is I'm seeing fewer and fewer dentists who are willing to participate with these networks. I know even my dentist right on Leroy Street, been around for 100 years. They just dropped 2 or 3 of the carriers they work with. Tough. It's a tough situation.
I'm retired from Teamsters Blue Collar, not supervisor. And I was able to keep my Teamsters dental for $15 a month.
15, that's great. God bless, because what's happening here is they're spreading that out. They got a huge population of people. They're probably including the actives in that number. You follow me? They got the 25-year-olds in there helping pay premiums to offset the cost for people in our age group. It's really what's happening. So,
All right, so I'm going to talk about a couple other cost hot buttons that I get every year. I find that, again, these tend to be the most valuable pieces of the presentation. The next item on the list would be skilled nursing facilities. That's huge. Skilled nursing is, for instance, let's say you go and you break your hip, you're in the hospital for several days, doctor says, you still need PT, you still need some, you still need some care. You might have wounds that need to be changed, medications that are still being administered through an IV. There could be several reasons. And they may say you need to go to skilled nursing for a few days. I could tell you immediately, no matter what insurance company you're on, that raises a red flag right there. Again, the prior authorization. It's going to be 100% required across 100% of the companies. And again, the doctor just has to show it's medically necessary for you to be there, that you actually need nursing care to be there. That's the big word in there, is the nursing care. So this is the most frequent panicked phone call I get regularly, I would say daily, maybe. It's from your children, okay? The children always call in a panic. Mom broke her hip. She's been in skilled nursing. They're discharging. They're kicking her out on Friday. I hear it all the time. Kicking her out on Friday and sending her home. She's not ready to go home. She can't even walk up a flight of stairs. The bathroom's on the second floor. What do I do? Like, no, and they're mad at the insurance company. Well, walking up a flight of stairs is not medically necessary, right? You don't need a nurse for that. You no longer fit the qualifications of a skilled nursing facility. This is where we now fall into what Medicare doesn't cover. They don't cover assisted living. They don't cover at-home nursing care traditionally, and they don't cover any long-term care. This is the greatest deficit that we see in our retirees, is what happens when I need that care, right? Do you know on an average in Binghamton what the average cost of assisted living is here per month? Very good. $7,500 a month. A month. That was a good guess. You've obviously been there. Yep. $7,500 a month per person. And that's just for assisted living. That means you can still cook on your own. You could still take your own meds. You could still make your own bed. That is the lowest level of care you could be receiving, $7,500 a month. Do you know what a nursing home in Binghamton costs per month? You took my class already. $15,000 a month. A month. Who's got it? Right? Even if you have a long-term care policy, most of the policies were set up that you have to pay the first 90 days first, and then the policy kicks in. Where's your $45,000 that they want as your deposit? What are we doing? Now we're going into your 403Bs and your 401Ks, and that's taxable, and we just pulled all that. And now everyone says, oh, well, I heard there's a spend down and a look back and all of that, right? So there is a Medicaid look back period of 5 years. And what that means is that if you are trying to qualify for Medicaid, because Medicaid is the only service that will actually pay for assisted living and long-term care, the only one, but you basically have to be destitute to get it. Right? So people try to spend down their assets. They'll create trusts. They give money to the kids, all that stuff. You can do a 5-year look back. And as long as your spending and gifting was in line with what you had always done, that's not the red flag they're looking for. What they're looking for is, I just signed my house over to my son so that Medicaid wouldn't take it. I just gave $250,000 to my niece because, I didn't want Medicaid to take it. That's the type of stuff they're looking for. But if you gift away, the gifting maximum, all right, let's just keep an easy number. I gift $1,000 to each of the grandkids every single year, I'm gifting it while I'm alive. Great. That's custom and usual for you. And that's not going to be part of this. However, as you're going through the assisted living and long-term care conversations, and you want to try to qualify for Medicaid, I would suggest anyone try to walk through a Medicaid facility, because that's what you also need to discover, which is that where you want your care? And number one, even those facilities, because they're the only ones that pay for it, they might have waiting lists that are a mile long. So again, depending on the facility, they have to be able to accept you. So even if you qualify for Medicaid, it doesn't mean you're instantly going to be in a facility close to your children or close to home. There may not be availability. So again, that's a huge, huge issue in our area, and they're having a lot of trouble funding nursing homes in New York. So it's gotten very expensive, and the rates just continue to grow. And as retirees, we haven't set that money aside, right? And said, who set aside $250,000 for long-term care? No one. And what I end up seeing is they spend it all on spouse number one, and they'll do that. Then that spouse passes away, and now there's nothing left for spouse number two. And I often hear, well, I'll go live with my son. I'll go live with my daughter. They'll take care of me. People are working longer. They're not home every day. They're still shuttling around kids. We're waiting longer to have children. So now our I was 48 when my son was born. Yeah, scary, right? 48 when my second son was born. So that was a shock. So now I am going to be that retiree with a kid in college. So now I'll have parents on the high end, a kid in college, and my retirement all at the same time. Where something's got to give, right? How do we make that work? So anyway, how do we make it work? By putting in plans like this, protecting it, right? Protecting you financially through your health care. So that's a big deal. So the conversation of, oh my gosh, they're kicking out mom on Friday. She's not ready to go home. Now the conversation I need to have with your children or your spouse is you need to hire someone. You have to. And so my father, it's crazy, got bit by a parasite in St. Lucia. Totally bizarre, walking on the beach in St. Lucia and ended up with this like crazy illness. We had to airlift him home. And my mother's promise to my dad was, you will never go into a nursing home. It's you and me. We've been married 50 years. He stays home. That was their promise. Well, the first night he was home, 3 o'clock in the morning, he had to go to the bathroom. She couldn't lift him. Now what? What'd she do with that promise, right? She called me the next morning. I just need a second pair of hands. Okay, we hired people. They, at that level, this was $26 an hour. A lot of people didn't have transportation. Oh, I need my sister to drop me off. I need, they might be one-car families. We don't have reliable public transportation out in the suburbs, right? It's only downtown. So if transportation became an issue, by day 3, my mother's like, I want a real nurse. Bring one in. What do I have to do? It's $100 an hour. Suddenly she was going through $2,500 a day to keep a nurse on staff. And again, we're not preparing our spouses or our children for those conversations, because for me to have to tell a son who's in crisis, you have to hire someone, figure it out, that is not a pretty conversation. So again, we want to keep having these conversations of what Medicare covers and doesn't cover. So when those situations happen, your children know what's included, what's not included, and how we proceed. The first thing that they are going to feel great about is that your hospital stay is protected, your skilled nursing is protected. Again, as long as the doctor can show it's medically necessary for you to have skilled nursing, it's covered on this plan. So that is amazing. There's also 2 little tricks in here. It's not going to save everything, but it'll help. When you are discharged from the hospital, your doctor can actually write a prescription for in-home nursing care. And you might get a nurse for an hour or 2 a day. They might come and change a wound or make sure that you are taking your medications. And that's great. It's not going to be your 24-hour care, nothing like that. But again, it may take some of the, the burden off if you're nervous about having someone home just out of the hospital. So they can write that prescription for 2 weeks, and that will be covered by Medicare. Again, as long as they could show it's medically necessary. The doctor can do it one more time after that. So you can get a month of nursing care at home. And I say nursing care being an hour or 2 a day, right? That would be covered under Medicare. Okay. I know we haven't done Medicare well, right? As a nation, it's a struggle. All right. So now we're going to talk about all the fun stuff. I want to talk about everything that we've added to the plan that is going to make your life just hopefully better and easier. And these things are not covered by Medicare. So one big one that was just recently added was transportation. And I'll explain why you might need it. It's 60 miles. You get, I think it was 24 trips a year at 60 miles each. So why would you need that? Let's say you're having cataract surgery, right? Someone may be able to, take you, drop you off at your appointment, but you don't know when you're going to be done, and they've got to go to work and they got to pick up the kids, and you may need a ride home. Great, fabulous, call. You can schedule a ride, and it's kind of like Lyft or Uber, and they'll be able to get you a ride home, no cost to you. You can get rides to, the hospital, to a doctor's office, to a pharmacy. Okay, so some people I don't want to drive in the snow. Okay, great, fabulous. Use the service, have them do it. If you're just not feeling well, right? You need to get to your doctor's office. Great, you can use it, go for it. So you have 24 trips a year. That's kind of nice, right? It's $0. Meals. Again, after someone's discharged from the hospital, you'll receive 14 home delivered meals over a 7-day period. That's every time you're discharged from the hospital. Again, taking the pressure off of your recovery. You don't have to drive anywhere and you don't have to cook. That's 2 things right there, right? And you can have your nursing at home. Hopefully that's 3 things now to help you recover and stay healthy. And, again, knowing you don't have to go home and cook, everything comes fully prepared. You just throw it in the microwave to heat it up. Done. And you get 14 of those meals. They're overnighted to you. Acupuncture is included. You have unlimited visits every year. So if anyone wants that, that's fabulous. We also have silver sneakers. So your gym membership is covered. So I have to clarify this a bit. Silver Sneakers is its own company. It's an actual company. Okay, so you could go to silversneakers.com. You could type in any zip code you want. So if you're traveling, you can go to a gym anywhere you want in the country. You can go to any gym that's on there. You could sign up for as many as you want. There's no limit. There are classes online and things like that. But I know when we travel, like, people who are snowbirding, great. You can go use a gym down there. That's awesome. So if your gym does not participate in Silver Sneakers, you can ask them to join Silver Sneakers, just speak to the manager, or you can contact Silver Sneakers and ask them to contact your gym. Okay, so maybe they could work something out. So again, it's really not an Aetna thing. Again, it's a third party, but Silver Sneakers is a great plan. They've been in business a long time. Everyone knows them. But again, if your facility isn't participating, ask them why. And, it just may not be on their radar screen. So again, that's something definitely to look at. Another big thing that I know people get a little nervous about telemedicine and a teledoc. But I do want to talk about that because that is all included in your plan. And I want to use some real life examples as to why you would use it. So I live in Dutchess County, a few hours south of here. They're down to like a crazy little number of dermatologists. It's like an 18-month wait for a dermatologist in Dutchess County. So what do? Right? You can absolutely wait your 18 months. Good luck with that melanoma. That's right. That's not going to work, right? So you can schedule an appointment with a dermatologist on your computer at home and show them anything you want. And people say, well, that's kind of weird, right? So my little guy, I told you I have a 3-year-old. When he was 6 months old, he had a diaper rash. It wouldn't go away. Would not go away. And I was panicked, right? So I called his pediatrician who said, I can get you in December 8th. Well, it was August. And I was like, seriously? You've been my pediatrician for 20 years. You can't get my son in for a diaper rash? He said, I'm sorry, we're booked. We can't. They were down to 2 pediatricians. And I thought that was absolutely atrocious. So I decided to experiment myself. I went online, scheduled a pediatrics appointment with my own insurance. They had an appointment for me within 15 minutes. The doctor was actually in California, so it opened up the entire country for me of doctors. I had this pediatrician. He said, lift him up. And here I am with this naked baby, and I'm like on the computer, and I said, oh, I'm so going to jail. And I was like, I've got this naked baby on a computer. Anyway, he saw what it was able to diagnose it, called in the prescription. Within a few hours, I was done, complete done. So the doctors can call in prescriptions. They could do what they want. I thought that was amazing. So for certain things, it's great. And I'll tell you where else it's great is for therapy. If anyone's in therapy, to be able to use video conferencing anywhere you want in the privacy of your own home, in a hotel room if you're traveling, if you're snowbirding, to say you can keep the stability of your therapist without having to switch, all because you can Zoom with them or whatever system that they're using, can save a life. That can truly save a family by being able to keep your mental health or substance abuse, right? We see that all the time. Again, people are just we're in programs. We need to stay regular and consistent, and those are crazy important. It's also been great for people who need refills on certain drugs. It's particularly things for panic attacks and depression. where your doctor's required to physically see you, right? To renew a prescription, they have to speak to you. So again, you can go right on the computer, they can do those visits, and then they can, mark it as, yes, I saw them, they're okay, we're good. And again, they could call in those prescriptions. That's
Samantha,
really
what's
nice.
the copay on that?
So it depends on the service, but Teladoc itself, which is the actual doctor, is zero. The other ones, so the healthcare providers, PT, OT, and PCP and a specialist, all $15. It's kind of neat, right? Some of them have a 20% copay. That's the mental health and stuff. But again, it depends on how your doctor's coding it. They could be considered a specialist. So if you're seeing a psychiatrist, it could be a specialist, then it's only 15. Again, it's all about codes and Medicare. So those are the ways I've seen them, which is amazing. One thing for women, not an awful lot of women in here, but one thing you should be like outraged about with Medicare, this is amazing. So they will cover your annual screening, so you get like a pap smear and stuff. Do you know what they don't cover in Medicare? Oh, they cover well, they actually do cover mammograms. They don't cover the conversation with the doctor during those exams. So you will be charged for that doctor visit. So where I live in Dutchess County, if you are even on a supplemental plan, like the AARP plans, and you think everything's free, they will charge you $250 to meet with that doctor because that conversation is not covered. But they don't charge you for the pap smear. And that's outrageous. How could they not cover that? Well, guess what? In our anger, I added it. It's on your plan. So now you can get your cervical vaginal cancer screening, the additional visit. We cover it every single year at $0. So yes, let's do the right thing, right? Stay healthy. It's awesome. But you can also get chiropractics on this as well. So there is one code that Medicare covers, and it's subluxation of the spine. So tell your chiropractor that's what's going to get the bill paid. If the doctor deviates from that, we had someone actually from Binghamton saying, I'm being charged an extra $3.70. You remember that? $3.70 for all my chiropractor visits. I don't know why. And it turned out it was because of the ice pack. They added an ice pack and they were calling it cold therapy, and they added that to the visit. So $3.70 apparently. So again, you deviate at all from subluxation of the spine, then the whole world opens. All right. Guys ready to talk some meds? Yeah. Yep. Go for it.
These are questions that have been sent in, and I want to make sure we get asked before we finish up. But, and this might be a question for the city, but what happens when a retiree dies? Can the spouse continue coverage?
So typically, yes, the spouse, as long as the retiree is already on the insurance, then the spouse carries the insurance at 100%. As long as the premium is paid. There is nothing that drops a widow from the insurance unless they leave the insurance, try another plan, which we've unfortunately seen. They figure out that it's not, no matter how many warnings you send, if you leave the plan as a widow, you cannot come back to the plan.
Okay, so you have lifelong coverage as a widow. Do you know what the New York City plan does? Anyone know? You are dropped the day your spouse dies. The day, not the end of the month, the day. I learned that with my family. My uncle passed away. My aunt was dropped that day and can't get coverage until the first of the following month, right? So you have lifelong benefits.
Okay.
That's amazing.
Okay. And this is another question for probably Sandy. But what happens if a retiree and their spouse are on the plan and then they decide to opt out? Can they get back in?
So typically, many of you and retirees still have their one-time opt back in onto Aetna. But again, it's case by case because I have to make sure you didn't use your one-time opt-in when you came into Aetna. Because some people don't take the insurance because they don't retire from the city. They leave with enough years of experience, time with the city. And so they went to work someplace else for a while. So that's not retiring. Remember, retiring is you have to retire from the city and retire and collect from Nisler. So if you did that and you've never left, then you have your one-time opt-in. So you get to come back on the plan once. So that's the only reason. We're just looking to see if you've ever weren't on the plan, like when you retired and came back on, that was your one time back in. So you can't leave again and come back in because you used it once.
And
There
just,
was actually a
I'm sorry,
specific reason
just so
for it.
everybody knows, that's in the charter now. That's not just a
Correct.
handshake agreement with Dean Tender or somebody else.
No.
That's actually been put into the charter that you can opt in one time.
Yeah, you can read it right inside the charter.
And this has been a great thorough explanation of the Aetna plan. But when somebody texted just now is, what's the major differences between 2023 or
Yep,
we're in
four.
24, excuse me, and next year? What's the biggest differences between the plan? None of this has changed. This is
This is
all
all
stuff
same.
that we've had all along. The biggest differences between this year and next year are,
We're getting into it right now.
okay. The other thing is just regarding rates. I just saw Chuck come in and maybe this is good timing. But why did Aetna's / the city's rate go up when Medicare plans did not? Go ahead. You got the mic.
Okay, so a couple of things. I'm going to back up for 1 second to Sandy's comment about your opt-in and opt-out. People say, why would you opt out? I'm going to tell you the specific scenarios of why the opt-in was put back in. Number one, there are certain hospitals that will not deal with Medicare Advantage. And there's 4: Sloan Kettering, Hospital for Special Surgery, Cleveland Clinic, and Mayo Clinic. If you are getting treatment at those 4 hospitals, and that means you are now doing chemo, right, or something like that, you might want to go off of that plan, get onto the expensive supplement plan, finish your treatment, finish it out, get healthy, do what you have to do to get those doctors in that plan, and then we put you back on when you're done, when you're ready and safe and done. Okay? That is what it was hopefully designed for, again, trying to make sure that in the worst case scenarios, you are safe and you don't have to worry that you can't get back on this plan. It wasn't supposed to be for someone making a mistake and all that. We've heard those. Try desperately to listen to these letters as they come to you with these alerts, because when the time comes, or if the time comes that you need to access one of those facilities and you want off to get onto a supplement, but you've already utilized your opt-out because you messed up, you're going to be heartbroken, right? Or your spouse is going to be heartbroken. So just be careful with that, because that's what we were, again, the heart was in the right place, right? Go get the care you need, come back if you need us, and I love that. So to answer your question, now we're back to why did the costs go up? I disagree that Medicare plans have not gone up. However, there are still $0 plans in the market, if that's what someone's referring to. But you will notice that their maximum out-of-pockets have changed significantly. They've also changed the cost per day of a hospital stay. So a way a traditional plan would work is it might be $395 a day for days 1 through 5, and then it drops down to 0. So in our case, in trying to maintain these benefits as is without any change, we went with the rate increase. We had a rate cap that Tom and I had worked on and got Aetna to approve a year ago, 2 years ago, which was amazing and saved this plan. But what was triggered was the national changes. So it was a federal mandate. And this is where we're now getting into what's changing. Every plan in the country is now being impacted by what's called the IRA, the Inflation Reduction Act. And for you guys, you're going to see the impact of that starting in January. So the number one biggest thing as a financial planner, I love this part for you guys, hate it for my insurance company, but love it for you. There is, for the very first time, a maximum out of pocket on prescription drugs. They've never had that before, ever. So if you were on an expensive drug like an Eliquis or the metastatic breast cancer drug, is like $9,500 a month. Okay. So again, you guys were protected by your copays on your plan, but your friends and family that weren't, let's say they had to pay 20% of a brand name drug. If you're on Ozempic or something like that, well, that's going to, again, create havoc to someone's retirement. So now what happens when you get to the $2,000? You guys likely won't reach the $2,000 max out of pocket based on your copay structure, and we'll go through that. However, your friends and family, they're on Ozempic, it's $1,600 a month. Well, that person now is done with their $2,000 in 6 weeks. Okay, what happens? The insurance company has to pick up everything else. The insurance companies have not figured out how they are going to pay for that. They are publicly traded companies. They have to respond to shareholders, and there's going to be an impact. So
Big deal here was last year, you could be out of pocket $10,000 on pharmacy.
Yep, absolutely. Not anymore. Not
Government is saying the maximum you can be out of pocket is 2,000.
Yep.
Is everybody aware of that? So $8, $10, $15,000 goes to 2. That's it. You can kind of imagine why premium's going up when they cut the out of pocket for you, which is great.
Yep, that's what I said. Love it for you guys.
Great.
Hate it for the insurance
But
companies.
instead of paying $8, $10, $12,000, $15,000, you're paying 2. That's it.
Yep.
Per person.
2,000 per person.
Annually.
And there is actually a more complicated formula than that, because you do get some credits for what the pharmaceutical company or the insurance company is paying towards that medication. So you're actually not going to reach your 2,000, but you're going to get credit for the 2,000 for a lot of people. So it's a little more complicated than that. But
Just to kind of clarify that.
yes, please.
So $2,000 is actually a combination of the cost of the medication and your out of pocket.
Yeah. Yep.
You follow that? So you won't be out of pocket 2,000. It's going to be 2,000, the combination of the actual cost of the drug and what your out of pockets are. So you're going to reach 2,000 very quickly.
Yeah. Very quickly, you'll be capped and it'll go to zero.
If you have a $500 medication and you're paying $25.
Yep. Eloquence. Yeah.
And the Medicare system now is saying, well, we would pay 100 or 200. That 200 is what is the,
Yep. That's what's being credited.
what's crediting
That's what
to
you're
the
being given
$2,000.
credit for towards your 2,000.
follow that?
I know, like I said, it's a little bit of a complicated formula.
It's a combination of the actual cost to Medicare, which the pharmaceutical company charges and is being reimbursed, plus what your percentage of that $200 is, whether it's a copay or whatever is your cost, plus the cost of the medication is the actual $2,000. So your real out of pocket might only be $500.
Yeah.
I mean, it's going to change based on the medication you're taking. But am I making any sense here? It's a combination. You're going from $8, $10, $12,000 liability this year to $2,000 combination cost of your out of pocket and the cost of the medication. That's the Inflation Reduction Act passed by this current administration. Wonderful if you're a participant in the plan. But I also want to caution you, someone has to pay for this.
That's where
And
we're
what's
not
going to
seeing the
happen
impact yet.
is not only is the premiums going towards paying for this, your individual federal tax bill is also going to pay for it going forward.
But
So
just to be clear, so when I'm comparing plans, you're saying that our plan now this year and next year is not changing at all, except for it's going from 8,000 down to 2. All the other things remain the same.
And
Some of the
it's
other
going from
plans, some of the other
yeah.
plans, the way that they're passing on the costs, they're not necessarily raising premiums. They're changing a bunch of stuff. And that's how they're paying for it.
Yep.
So
let's,
that's, you got to compare apples to apples.
It's on those plans may be significantly higher
Yep.
in various categories.
And we're seeing a lot of the additional benefits in the open market getting slimmed down. So for instance, they might have had $2,000 of dental last year. Maybe they're only doing 1,000 this year. They may have, for certain plans, now they've implemented, the full drug deductible down to tier 1, tier 2. So in most of the public plans that you could get in the open market, typically the deductible for the drug plan starts at tier 3. So it's $590 this year. You guys have no deductible on any tier. So instantly you're saving that money right there. Again, as you're looking at your friends and coworkers, if you say I'm on a tier 3 drug or higher, ask them what their deductible is for their drugs. It's going to be $590 or, therefore around there somewhere for those expensive drugs. So for you guys, let's just say you go to, and again, it doesn't matter, a preferred or a standard pharmacy. You have no price difference at the top tiers between those two. You can go to any pharmacy you want. However, when you're on the generics, it's going to be cheaper to go to a preferred pharmacy. So preferred pharmacies will be your mail order, which is through CVS Caremark. So you can get it delivered at home. And again, that's national. So with the CVS plan, you can have it delivered to, wherever you're snowbirding. If you're out of town, you need to pick up medications, just go to any CVS and they're able to pull up your account nationally. So that's really helpful. I've actually done that myself, and it really does work. The preferred pharmacies that I see the most up here in Binghamton, if you don't have, we do have some CVSs, but not an awful lot. But Wegmans and Walmart are all, preferred. So that's great. If you're using something like Walgreens, Rite Aid, it doesn't matter. You can go anywhere you want. If you're using a mom and pop, go anywhere you want. It doesn't matter. Again, your drugs will be covered, but when you're in that generic level, it'll be $27 for a 90-day supply at preferred and $30 if you are at a standard. That's it.
So if you're also taking a daily pill, cholesterol, high blood pressure, right? These are medications you're conceivably going to take for the rest of your life, every day. Are you using mail order medications? Call your doctor. They know exactly what to do. CVS Caremark is wonderful. Comes to your home. You get 90-day supply for lower cost. No more waiting at the pharmacy. CVS Caremark is the mail order pharmacy that you use and let your doctor know, I have CVS Caremark. I'm taking a daily pill to control cholesterol and blood pressure. Have it sent to your home, 90-day supply. You get a lower copay than what she's describing to go to a 30-day and showing up at the pharmacy. No more waiting in line. No more pharmacy visits. Right to your home. Plain wrapper. It couldn't work better.
Yeah.
Just call your doctor and refill it. And they're like, done.
Again, in New York,
You get an
right?
email saying, yep, we got it. You're going to get this mailed out to you in 3 to 5 days.
We don't have to worry about snowstorms and ice and, oh, I forgot, and the thing's been empty on my counter for 3 days. I forgot to refill it. All the stories we hear, right? It's just delivered right to you 10 days prior to the refill date. So you're going to have it in plenty of time. Okay. So another change for 2025 is, for the first time ever, every single prescription drug insurance company on Medicare is required to offer what's called M3P, as if they couldn't make this any more complicated. It is the Medicare Prescription Payment Plan. So they now have to offer everyone a way to pay for their medications all year long. Okay. You will receive a flyer in the mail from the insurance company, and from any insurance company that that is your prescription drug plan. In this case, it's Aetna. And you have to opt in to the program. And what that means is that you won't pay this copay to the pharmacy when you go get your meds. You will receive a bill from Aetna that spreads out the cost of that drug over the course of the year. So you'll pay Aetna directly. Every insurance company is required to offer that for next year. So I always like to, say, what happens when an entire nation goes live on a system on the same day? It's not going to go well, right? January 2nd is not going to be pretty, okay? So as they are implementing this change, I always say, it's going to crash. None of the systems have been tested by any of these companies except in their little user units. When we suddenly throw millions and millions of people onto this plan on January 2nd, I'd be shocked if something went really well. So be patient with it. It's required. They have to fix it. They have to get it through. However, what I don't want is anyone to freak out on January 2nd that you're not getting your medications. Okay. So again, we don't know how that's going to impact pharmacies and the insurance companies. So as a note of caution, kind of like we did before Y2K, right, which never materialized, make sure you have enough medications on hand in December. Try to get your 90-day fills. If you are on a critical medication like an insulin or Eliquis, something like that, that's keeping you alive, dear God, don't wait. Make sure you have enough on hand to get through that first week of January. Because if the pharmacy systems crash, I don't want you to become the victim of it. Okay? We have to give every one of these companies time to navigate through the tech that they're going to have to go through the first week of January. So again, just be patient. I mean, again, there's nothing saying that that's not going to go well. I just don't want you to become victims of it. There are things you can do proactively to make sure you're safe and protected in your house. Okay?
That plan.
You do. You have
Nobody
to
follow
opt
this.
in.
So let's go back to the example, $2,000 out of pocket, combination of cost and your out of pocket. The government is saying the pharmacy costs can be budgeted. So you can spread out your $600 out in 12 months and the carrier has to track it and they have to help you budget this. That's what they're saying.
Yep. And they have to now
can do
accept
that.
payments.
That's the government,
And now they need to mail out bills every single month. And, yeah.
but it's an opt-in. You don't
It's an
have to do
opt-in.
that.
Yep.
You can just pay like, what normally pay. If you decide that your $600 has to be spread out over 12 months, the carrier has to do this for you.
Yep. So again, it
Adding
wasn't
complication, as you probably can imagine. right?
exactly. So on your plan, your prescription drugs were protected by these copays to begin with, that the most you are going to be held liable for a 90-day supply is $120 for a 90-day supply of medications. That's if you are on the most expensive drug the company has to offer, you're capped at $120. So you may never reach anywhere near that. The plan that the government passed wasn't designed for someone on a protected plan like this. It was designed for the people on the metastatic breast cancer drugs and the crazy insulin prices and all of that. The people that are spending $20,000, $30,000, $40,000 a month or a year on medications so that they could spread it out over the course of the year. Again, trying to stop the bleeding of someone derailing their retirement. If we could give them time, then that's what they were trying to do. However, it's a big system to put into place on a single day. So, and again, every insurance company is allowed to do whatever they want system-wise. They just have to offer the plan and implement it. So that's going to be the biggest change for you, not for you, but for the nation next year, right? Again, you will be minimally impacted because your copays are so low. But going forward, your friends and family are going to be awfully safe as long as that policy stays in place.
Questions? That's what we're trying to do next.
I just want to make sure I'm not missing something on this MP3. Everybody in the nation should opt in, has to opt in. No.
Do not have to opt in. If your prescription bills are more than $50, you can opt in and they will spread out the cost over the entire year. If you say, I don't care. I'll just pay it. You know, when I go to the pharmacy, you don't have to opt in. You can just continue on your way and you don't have to do anything at all. Nothing at all. Everything for you stays the same. It was really designed for people with exorbitant drug costs that are trying to spread it over 12 months. That's the big deal.
But if they know this is going to take effect
Yep.
as of the first of the year, why can't we opt in now?
You can opt in now. The forms are coming out now. They were just waiting for what's called the final rule by Medicare, which was just finalized, letting every insurance company know exactly how everything had to be worded and how everything had to be implemented. So you will be given the option to opt in now, but the billing itself doesn't start, and the regulation for the M3P doesn't start until January 1. So. So the next thing I do want to say, if I could just have 1 minute, I want to talk about prior authorizations for medications for a second, because that tends to be a really big hot button. As we discussed with other medicals getting prior authorizations, you may also be requested to get a prior authorizations for your drugs. So not you, but your doctor is getting a prior authorization for the drug. And you may say, hey, I've been on this insulin for 20 years. Why am I suddenly getting, a prior authorization? What's going on? So every insurance company has the list of drugs that they cover. They also cover a certain number of generics, right? If generics are offered. So company A may use one distributor and one generic, let's say for an insulin, but like our formulary may use a different generic from a different distributor. The prior authorization may be just having your doctor confirm that they approve that we're changing you from generic number 1 to generic number 2 because of the distributor. May have nothing at all to do with your medication. Number 2, again, a reason why we're seeing an increased number of prior authorizations has to do with the list of side effects that have been identified by, the FDA. So for instance, let's take Zoloft, right, which is an antidepressant drug. People have been on it for decades. Suddenly you can only get a 30-day supply. Why, right? A lot of angry phone calls. I've been on this drug for 30 years. Why? Well, it's been identified to have suicidal tendencies as a side effect. They want your doctor to speak to you every 30 days, and they won't allow you to get more until you do. So those are, again, heart was in the right place, but creating a little drama. So, again, people get upset. That's, again, where the telehealth would come into play. You could video call them right on your phone. It's just to do a wellness check to make sure you're okay. Okay, so prior authorizations, if you do get a denial for a drug, again, just like the medical side, your doctor can ask for an exception to be made. If you have to take the brand of a drug instead of the generic, we see with Synthroid all the time, all your doctor has to say is, hey, we tried the generic, they had a reaction, it didn't work, wasn't effective, these were the test results, boom, this is why I chose the brand. Done. They just have to show it was medically necessary, and you're done. And again, so you can get an exception made, you can appeal. Okay? All right. I'm done, Sandy. Thank you.
And the same note, the 90-day prescription. Example, Jardian, I was getting a 90-day supply of it. Then all of a sudden I go into the pharmacy to pick up my 90-day supply. It's only 30. What's the correction?
So again, certain things have now triggered prior authorizations or limits. It's called QLs, quantity limits. Jardiance is one of them. Eliquis may be one of them. So it could be for 2 reasons. 1, because of a side effect that's been identified. Number 2 could be if someone is taking advantage of it, kind of like an opioid, where if they found that there's an addictive quality to it, that could be. I don't know if that's the case with Jardiance. But number 3, the doctor justifying why you need the brand of Jardiance instead of the generic. And again, saying why, because it'll be a red flag every single time. So we see it with Ozempic all the time. And another thing for people to know is there are certain drugs Medicare doesn't cover at all. Weight loss drugs, they don't cover them at all. So if you're taking Wegovy or Zepbound, that's not going to be covered under Medicare. But if you're taking Mounjaro and Ozempic, you have to be pre-diabetic or diabetic, and then that will be covered again as long as your doctor shows the testing and that it was medically necessary. And again, as what we expect is as the FDA approves other positive side effects from these medications, it will become more frequently available for, for people. So I've had people with heart conditions that were approved for these diabetic drugs because again, one of the side effects, you lose the weight, it helps you, might help your heart and take the stress off, that, you may be able to get certain things approved with an exception being made. But Wegovy and Zepbound, which are strictly for weight loss, those are not covered by Medicare at this point.
I have a question regarding if you have to go like to Albany for a vascular surgeon who you've seen for years, and you get a letter saying that Aetna is no longer going to cover that. What do we do?
So Aetna's not covering it for what reason? Because they're no longer in network or because the
They're
service
not-
wasn't approved?
They're not participating.
Okay, so again, if you get a letter from any provider that says we are no longer participating with Aetna, in New York, they're very strict. They have to send out letters advising you, right, when a negotiation is taking place. So a lot of times you'll get these letters like 90 days in advance, and then somehow through the negotiations, which always go up as with any union, right, goes up until the night before, and suddenly they come to an agreement, and now that was all for naught, and everyone was in a panic. So that is usually what happens was, again, you were given the pre-note that a negotiation's taking place, and they're going through active negotiations. If the negotiation fails and it doesn't go through, all they have to do, number one, participate in Medicare. Number two, agree to send Aetna the bill. And again, use the line, this employer retiree plan through the city of Binghamton. That it gives them a whole different perspective and as far as how they get paid, how everything's allotted and what you're allowed to do on your plan. So you have an ESA PPO. All of that language gets you in easier, right? So again, if you run into those issues, again, we have, a big service team behind us that if you have a challenge like that, and if you're unable to get them to hear you, right, we can have our provider relations team reach out to them directly to let them know how they're going to get paid. That's what they want to know. How are we getting paid for this service? So again, I don't want you hit with a, like Tom's surgery, right? You don't want to get hit with a $45,000 bill that you have to pay up front. Otherwise, they're not touching you today and you've had the surgery planned for 6 months. That's horrible. No, they have to send us the bill. So we don't want you caught in that situation. Yeah. In the case of an emergency, though, this is important, where you think your life is at stake. Any hospital, any service is in network. Anything, okay? Anywhere in the country. Any hospital is in network, any ambulance is in network in the case of an emergency, which means you think your life is in danger.
Isn't that it? Isn't that also worldwide?
It is worldwide, yes. Well,
No matter where you
yeah,
are,
on this plan, it's
if you're in an
worldwide.
emergency, life-threatening situation, it's covered.
Yep, on this plan.
Does anybody have any other questions?
Just a quick question about the phone calls that come to the house. I don't know if anybody else has been getting them, but from a call center, I think, for Aetna. So it gets very annoying. And what do they really want? Because I'm not having somebody come to the house. It seems, I
So-
think that was one thing that they wanted to do.
Healthy home visits is one thing. All the insurance companies seem to be doing it, which is that they will send a nurse to your house and basically do your annual physical for you at your house, so you don't have to go to a doctor's office. And they can also do a walkthrough with you of your home to look for safety issues to help you kind of navigate through. Okay, let's say you have a spouse that's showing signs of dementia. You may want to protect your stove. You may want to protect your stairs. You may want to protect, locks on your doors so no one can escape, like run out in the middle of the night type of thing. They can walk you through that. They can also help you find local services that are helpful, right? Your office of the aging and things like that. However, home visits, not at all required, okay? Absolutely not at all required. There's also, again, Aetna is owned by CVS, that's the parent company. They also own several other companies. One is Signify Health, who does the home visits. One is also, I think it's called Oakwood. And so if you haven't assigned a primary care physician on your account, they want you to have one so you can get your annual physical, get all your preventative care, because we believe in that. They'll help you find one if you don't have one. So there are in all these different companies, people calling, to get their, they're checking the boxes. Do they have a PCP? Have they done a home visit? Are they taking, advantage of the wellness? All of that. Have they signed up for the mail order for the drugs? So you do feel like you're getting bombarded and you don't know which calls are real and which ones aren't. That's important to know. So always, if you can avoid it, ever give your Medicare number, your member number, your credit card information over the phone to anybody, okay? Anyone. And the only time I would say that is if you physically call yourself, you proactively call CVS Caremark to set up your mail order, that's when they would require your credit card because they need to know how you want your drugs paid. But you call them, you call the pharmacy number on the back of your card. That's the legitimate number, okay? They're the only ones who would ever ask for a credit card over the phone from anyone. Otherwise, no one, and even through all of Aetna, no one should know your Medicare number. If it's a true Aetna rep, they will have your member ID, okay, which is secure. No one has access outside of my department for your Medicare information, your address, anything like that. So again, all of those programs are optional. You do not have to sign in anything. If it's mandatory, I'll let you know.
Any other questions for today? I hope it was helpful.
I want to thank Samantha and Aetna for providing us with this information. Thank you. Sandy, Chuck, thank you.
Thank you.
Folks, I just want you to know that we're here to help you. And it isn't always just about getting open enrollment done. Once you've gotten through this and you have your new cards and so on, because I assume they're going to get new cards because the plan is changing. We also want you to know that if you have problems, issues, or questions related to anything we've talked about today, you can always call my office as well. We've now got your summaries. I know there was a little issue there. We didn't have your summaries. We didn't have the official word on everything that was happening. We do now. If you have questions, issues, problems, 95% of what she's described works very well. Most providers know what to do, the hospitals and so on. They run like clockwork, but occasionally they don't. And when that occurs, don't panic. Give us a call. We know who to call. We know what to ask. We know how to get it done. We will help. Okay? The city cares a great deal about you and your families and wants to make sure you've got quality care, quality coverage for the right price. As you can probably tell, this stuff has gotten very, very expensive and probably will continue to go up. But we're doing our best to make sure you're getting what you're paying for. Thank you for coming today.
Can I ask one other question? Has anybody received a new Medicare card? As far as a new number?
Some
Okay.
people, due to the security breach with
There
United
was the
Healthcare,
security breach.
they
so-
had to reissue certain people's numbers if they changed. If your Medicare number has changed and you get a new number, you need to let Sandy know so that she can make sure you stay enrolled in the plan.